Hey, everybody, this is Munson Steve. Health IQ. We are in Black History Month, something that may give you some idea of the history of you and your health. But there's a healer, a young lady who's dedicated to the healing of our community. And I say young lady, but she is a whole doctor. Dr. Mo, how are you?
I'm doing well. Thank you for having me today. Good to see you.
Oh, it's good to see you. I got to come visit. When we think about our health and our health IQ going up, we've been in a pandemic going on 2 years. We started the pandemic without a vaccine. And now, Dr. Mo, we have a vaccine and we still are having to think about and ponder, should we take a vaccine? Where are we literally, other than COVID fatigue, but what are we doing when we deny ourselves, particularly adults, the vaccine?
Well, this has been such a hot button topic for the past couple of years. I have been knee deep in this debate with people. From my perspective, it's not a debate. I mean, the numbers, we have the numbers, we have the information. The numbers don't lie. The numbers are telling us that vaccinating oneself and one's family against COVID leads to a lower likelihood of having a serious adverse outcome. We know that it decreases the possibility of spreading the disease. It decreases the possibility of developing serious illness and hospitalization and death. And so people have a number of different reasons why they're choosing not to take the vaccine or why they're choosing to wait. A lot of times I'm seeing, what I'm really seeing a lot of is young people who feel as though COVID is not a real threat to them. And so they don't feel the need to be vaccinated because, they're eating well, or they're exercising, or they're taking vitamins or emergency or whatever it is. But what people fail to realize is that you're trying to protect other people. You're not just protecting yourself. You're trying to protect other people, other vulnerable people around you. And that's what we really need to have. We need to have a collective understanding of what vaccination means in terms of protection. There's a lot of wild cards here. We have the Omicron variant, which is less severe than the Delta variant. But we have no idea what kind of variants are coming down the pipeline. We don't know if future variants will go along with the same trend as Omicron has, where it's more transmissible but less severe, or if we will have another more severe variant like Delta in the future. But what it looks like, and I'll compare this to the flu, for example. Every year, the flu changes. We have different variants of the flu every year. And because of that, we have different vaccines for the flu every year based on the genetics of the virus. And that's how it looks. It looks like COVID is headed in that same direction. So the short answer to your question is that we're denying ourselves the best chance possible to give our immune systems the boost that they need to protect ourselves and our loved ones and the other people in our communities.
Thank you, Dr. Mo. So you hear the individuals who are clearly now 2 years in, talking about why we should not be taking the vaccine. And there are a ton of conspiracy theories and misplaced. It's like Tuskegee, which clearly was not about giving care. Obviously, it was about reducing and not giving care. And so you have a whole lot of conversation. But just in terms of Black health, period, what should we be doing now just with health awareness? It's your history, your family history. How do you share that history? If your dad had prostate cancer, are you gonna, first quarter is your habit of getting a monthly, no, an annual or biannual, if you're over 50, basic health check. Did you go in and have an accountability partner for your mammogram and your colonoscopy and all of these things just for general health principles? Do you see an increase in our awareness at this moment that COVID has said, not only should we pivot on thinking about COVID, we have to all pivot on better health and identifying, at least if you can't find a Black health care provider like yourself and professional, finding somebody you trust and somebody who will be an advocate for your health and your well-being. What say you, Dr. Mo?
You know, as much emphasis that's being placed on vaccination, which is important, I think that the public has been, we've done a disservice to the public by not emphasizing more the importance of health maintenance and all the things that you just talked about. In terms of protecting ourselves against COVID, I don't think we have collectively as a country placed enough emphasis on the importance of good food and nutrition, eating an anti-inflammatory diet, supplementing our nutrition with different vitamins as indicated, getting enough sunlight, going in for our routine screenings, whether that's colon cancer screening on an annual basis, breast cancer screening, lipid, cholesterol screening, A1C, diabetes screening. And unfortunately, I feel as though a lot of the things that helped people in our community to get some of those screenings done, such as community health fairs, partnering with churches and schools and other community centers, a lot of those events that have promoted, preventive screening have been scaled back because of COVID. And so I feel as though we need to start thinking about how we can bring some of these really effective strategies back in terms of increasing screening and health literacy in our communities in the face of COVID, and do it in the safest way possible, because we know that these things are effective in prevent chronic disease prevention and management. So I think that we have more work to do in that respect in terms of raising awareness. I do think that people are more aware because they see that the threat of COVID is real, and they see that people who have chronic diseases are more vulnerable to COVID infection. I think that there's a lot more that we can do in that respect.
Well, I love the way you say a lot more. You say it so positively. For those who don't know, there are not enough Black doctors. Why? Why did you choose to take a difficult road? And obviously you have the capacity, obviously you have agency to be that, but just so that we know what Black physicians go through, Black medical students go through, and share why some other students who may be doubting themselves that they can become a Black doctor and really be a healer. Can you share, and still like hip hop music, because y'all know she raps. Can you share just your journey with our audience so that they kind of see what motivated you, and really the difference you see, because I know it, I see it. It uplifts me every time I see you. And I know that there's one more person. If I got 66666, not that I don't have doctors here, but I do have somebody I could lean into. Hey, Helen, help me out. Hey, I got, this was going on. Why'd you choose the journey? Because I thank you for it, but why'd you choose the journey? I know you don't get enough thankful letters, but why'd you choose this journey, which is arduous and demanding and cost a lot and have to sacrifice a lot?
I really appreciate that question. It's really disheartening to see some of these numbers, how we had seen that the number of Black men in medicine was less now than it was in the 1970s. And there's a number of different reasons for that. It's really challenging to exist in a space that we were never meant to occupy, and to deal with forces on a daily basis that are meant to try to beat us down in terms of racism, and something that's called imposter syndrome that I think affects a lot of us Black people in medicine. But I can tell you that I was inspired by people in my community, particularly elders. I'm planning to become a geriatrician because of my love for our elders and the need to take care of them. And I would hear stories from them about how they felt like their doctor wasn't listening to them, how they didn't feel like their concerns were being taken seriously. And I just saw how important it was that there be someone in the white coat that understands these patients and loves them and will work very hard to promote their health. And so myself, other Black doctors, we took this road. It is not an easy road, but because of the love that we have for our people and the clear evidence that we need Black doctors to fight against some of the injustices that have happened to us in the past and currently, that have injustices that have been inflicted upon us by the medical establishment. We have to work from the inside out to address those issues. And, every time I have a patient that sees me and they're just so happy to see like a Black doctor, on my hardest days, that's the kinds of things that keep me going.
Bernadette from Facebook says to tell you hello from New York. She just wanted to shout out. Thanks, Bernadette. But for those who are really struggling, when you think about, we've got seniors now, and clearly some people are living longer. Taking care of our seniors during COVID, when we lost so many based on people walking COVID into the home of their grandparents, really, or even workers in nursing homes, huge disparity and impact on them. But what should we know to be able to help our seniors stay active when, some tools, some tips, because many seniors are isolated right now. And they've been isolated for 2 years and obviously not having those activities. What can caretakers, we do with technology to engage, check in, and motivate our seniors not to get docile during this moment of COVID as a caretaker? How do we walk our parents through, FaceTiming with them and telling them to get up and literally giving them little treats, as I have given my mother to say, carry 2 bottles of water and walk for 5 minutes just for me. And then I'll call you back. Let's walk for 4 or 5 more minutes and I'll keep you on the phone and just put it down, put it on speaker, and we'll keep each other active. She gets a kick out of that. She just gets the biggest kick and says how much stronger she's getting. And just walking our seniors and loving them since they're isolated. Mm-hmm. What kind of tips do you have for us?
I really appreciate you bringing this up. I feel like the social isolation and the mental health impact, particularly on our seniors, has been one of the greatest tragedies of this pandemic. And I really appreciate what you've been doing for your mother. And that's really what it's about. We just have to be really creative, getting them what they need for technology, taking the time to show them how to use the technology, taking the time to find, different resources, virtual resources that exist. I'll give an example. HipHop Public Health, the organization I represent as an advisory board member. We also have an organization we're affiliated with called Arts and Minds, which is a virtual arts and dementia program for people with dementia and their caregivers. And we offer these really robust virtual programs and as an opportunity to interact with other older adults who have similar condition. So there's tons of resources out there for people in public health and medicine. The onus is on us to figure out what is missing and what we need to do to create new programs and initiatives to address some of these issues of social isolation. We just have to do it. We cannot use COVID as an excuse. And frankly, I just feel that COVID has been used as an excuse to just not do a lot of things that need to be done and that have been shown to be effective. And I really think that we need to change adjust our lens to think about how can we do it instead of why we can't.
Yes, I love that. Why we can versus why we can't. I think that's part of the idea. And to your point, my mother was 87 Saturday that just passed, and I flew out there to see her, and obviously I still wore my mask. She's like, "Why are you wearing your mask? You tested?" And I said, "Well, if the tests get it wrong, I still just want to have on the mask."
Mhm.
She's like, "But you're wearing it in the house." And I said, "Yeah, I'm wearing it in the house. It just might." She said, "Well, you're gonna sit here all day with the mask?" And I said, "Yeah, that's what I'm gonna do." And
Yeah.
we were there. But her comment was she was happy that she didn't spend her birthday by herself,
Mhm.
and she really leaned into by herself. And I think many, even if you can't, go into your neighbor's house, just walk them around the block or walk them down the street, back up the street, 5, 10 minutes, and it makes a difference. She and I took a little walk, and you would have thought we were in a park and had a wonderful time. It was just a cul-de-sac and 2 blocks, and came back around, and she felt like she had been in a marathon, and
Mhm.
smiled like her giving
Take
a pep.
much. It doesn't take much. Just that little bit of is it can go a very long way for supporting the mental health. And I'll say the same for our children too. I feel that our children have been significantly affected, their mental health in terms of isolation, their development with virtual learning. And I think that they also deserve special attention in that respect as well.
I think the beauty of what you said is even understanding. I think the advent of giving mental health into our vocabulary as a community, and yet we are going to have to grow and decipher what that means. And what I'll share is, it might give your child might be suffering from anxiety based on isolation. Well, that's anxiety. So at least when you take them to a physician or a psychologist or psychiatrist, it ain't that your baby don't want to talk, but they might be anxious that people are dying, anxiety. So share some of the language when you're as a physician can see that the mental health and kind of words and language that we can grow our vocabulary as a Black community as it relates to mental health. Because we can't just say mental health, because then I'm like, well, what you got? What
Mhm.
part of mental health are you having? Is it anxiety? You feel depressed? Our language. What
Mhm.
should we know about mental health, and how do we increase the vocabulary so people can begin to at least share what they're feeling from a mental health perspective during not only COVID, but just in many of the other things: loss of job, loss of relationships, loss of grieving of loved ones in this moment.
I'm going to share a couple of concepts that I think are key concepts for people to keep in mind. The first is called ACE or ACEs, which refers to adverse childhood experiences. And basically, it's in reference to the effects of trauma on our health. And the number, and we have studies to suggest that the higher the number of adverse childhood experiences that a person has, the higher the likelihood that they will suffer from chronic illnesses and other illnesses in the future. Another concept I'd like to address is called the weathering hypothesis, which basically explains that trauma associated with racism, sexism, and other stressors in our life have an effect on the body at the cellular level, and can essentially shorten our lifespan. And so we really have to think, when you think about those things, we have to think about addressing trauma, addressing our physical health, and how that impacts our mental health. Um, Another thing that's important in talking about mental health is stigma. You know, people who are like, I don't need to go to a therapist, or I don't need to talk to anybody. I'm not crazy. That's just not the kind of that's not the kind of language that we need to be using. A lot of times people feel like, oh, I just need to talk to my pastor, or I just need to talk to somebody at my church to get through this. All of those things are important. Support from family, support from your church members, support from wherever you get it is important. But sometimes if you're really if you're really feeling low, if you're really feeling a rut, if you can't get out of bed in the morning, if you're that beat down, sometimes talking to someone or even taking a medication for a short period of time is what you need. It has to be a multimodal approach to making sure that you're on an even keel and can function. And it's important for us to keep a lookout uh, for our loved ones, and try to look out for kind of red flags in their behavior. You kind of know when you're not feeling like yourself. But then you can tell when a loved one's not quite feeling like themselves or is not quite themselves, regardless of what they tell you. So we really just have to be so proactive, and loving and open to having these conversations and get rid of the stigma.
Well, I think between you and your homeboy Charlemagne, the guy who clearly has made mental health a conversation, and I love the ACE, because I think the idea that even parents that don't have it right can make broken children. Without, if you display anger and it traumatizes your child, you say what they're not going to become early in life. You describe them in a way that you were ruined, and somebody said you were super black and you weren't good looking and described you in a way. Mentally, that child has no place to run now, if they're not going to school, and then they can't kind of socialize. So now they're being traumatized at home. The other thing is just lack, given that we've been going through a ton of inflation, a ton of community members. Our unemployment is still higher than white unemployment. So you have all of those stressors that trigger behaviors that are unhealthy. Can you share about triggering and what people need to look out for that could actually affect their health and their mental health at the same time?
Sure. I mean, it could be anything. There's just so many different triggers that we can encounter throughout the day. Whether that be at home or at work or, at school. And, what do? We have to think about healthy ways to address that. That's something that I've had to deal with as a resident. You know, I might want to reach for, I might want to get a burger, or I might want to get some like really greasy fried food because I'm upset about something. Some people might reach for the bottle. Some people might reach for a joint. Some people might reach for, um, anything that's all kinds of injurious things. What is the best thing to do? The only way I've made it through residency is by exercising on a regular basis. That is what has allowed me to stay sane, as a medical doctor in a pandemic. And we just have to think about what are the healthiest coping mechanisms that we have access to, that can help us to just maintain at a baseline. If it's listening to music, music can be very healing, and that's a kind of our mantra at HipHop Public Health. Just finding positive, beneficial coping mechanisms, not things that are going to make the situation even worse than it is, impacting our physical health. Um, yeah, there's just so many different places you can go with that. One thing I like to share with people, something I always say to my patients is, you go to the gym to maintain your physical health. You go to a therapist to maintain your mental health. It's the exact same thing. It's all about maintenance.
So that brings us to maintenance and family, Black History Month. How do you talk about health with your family, your children? Ask those questions about, what did grandma die from? Nobody wants to ask that question. Did my grandmother, what is your personal health? How do you begin to address those things in advance of having, the ambulance at your front door and somebody is falling out? How do you take that person and do an inventory if they haven't gone to the doctor? What are ways to kind of get them and encourage them to allow you to bring them so that we're not in that critical care, but we're in much more of a managed care scenario?
I want to talk about that a couple different ways. The first thing I want to talk about is how powerful our children are in terms of initiating these conversations about health. That is the whole model that HipHop Public Health is built upon, child-mediated health communication. We have used multimedia to educate children about health so they will in turn come home and educate their parents and grandparents. I have a close family member who was told she had high blood pressure, didn't want to take her medication, but then her daughter said, "Mom, please take your meds." And she would not have done that had her daughter not asked her to do it, her young daughter not asked her to do it. And so I think that I think that educating our children is one really great way to promote health conversations about health within family units. Another thing that I really appreciated, I'm assuming that you're a fan of Insecure. Of course, I'm an Angelino, so you know I watched all of Insecure. But one of the last episodes of that show involved the family doing estate planning and talking, not even just estate planning, but talking about advanced care planning, talking about what matters most, what kind of care would you want in the event of something happening to you? How do you see what's important to you in your life? What do you want to live for? Like, these are really deep conversations. And a lot of times people want to shy away from them because they can be uncomfortable. Oftentimes your doctor should be the one that can help at least get the conversation started. And if it's difficult to do that in the household, sometimes you can try to do it within the setting of a doctor's office to get some assistance. But all of it has to come from a place of love. And I think as long as it's presented in that respect, like, I'm talking to you about this because I love you, because I don't want you to suffer, because I want you to be with us for a while. Please take your medication. Please go to your appointments. I think that that's just the best way. We have to just be open and honest with each other as best we can and try to get as much accurate information as possible to share with our loved ones.
Well, I love him, and he's not here today. So, we're going to say toast and Happy New Year to my brother over there, Dr. Williams at HipHop Health. We both give you a salute for his dedication and love. And he always makes the health conversation relevant. What's it like to be on a team with, obviously, rock star doctor in Dr. Williams, and then have literal hip hop legends and rock stars and hip hop gods like yourself rapping with DMC and Dougie Fresh, all committed to making it accessible, influencing people to participate in health as a conversation? Like, what's that like for you when you literally think Dougie and you and the whole team are really doing outreach? How's that feel?
I have to just tell you, it's surreal. I first met Dr. Williams in 2009. I had just finished my master's in public health. He saw potential in me and gave me a shot. And I'm so grateful, but never could I have imagined that, I rapped on stage with Dougie and Chuck, big shout out to them, hung out with DMC. I never imagined that I would have such unique opportunities like this. I think we're just all connected by the fact that we recognize how powerful hip hop is as a culture, as a language. There's no other force that has been able to capture the experience of marginalized people worldwide, all over the globe in the way that hip hop has. And no other musical genre has the same amount of power to communicate these important messages around health, around healing, around trauma that hip hop has. And so I am just so honored to be in the company of these amazing people who've seen me from just a little bright-eyed, bushy-tailed, like 20-something in New York City, here now to serving my community here in LA. And I think that we're just getting started. There's so much more that we can do through Hip Hop Public Health, using hip hop as a medium to serve our communities. So a big shout out to Doug, Chuck, DMC, Dr. Williams, Dr. Noble. Let's keep it rolling. Let's keep going.
Yeah, I love it. And I love the use of animation, which is always a part of what I see. But I think about when you say stroke, and I think we're not thinking about strokes right now. I think we don't understand, high blood pressure and stroke, there's a correlation. And when we see people that have that issue where one side of their body has been impacted, and most people can't feel if they have high blood pressure, and why we should check in and understand what it is. Where does stroke play a role with high blood pressure, and why should families who have, if your mom has high blood pressure, what should you kind of know that might be waiting for you if you don't pay attention?
You know, knowing your family history, that's where we're just talking about these honest conversations with our family members. Knowing your family history is so very important. One of the first things that a doctor is going to ask you about the first time you see a doctor is about family history of stroke, hypertension, diabetes, cancer, because there may be genetics at play that put you at a greater risk of developing those things. And something that's also important, people need to understand that with COVID, COVID can potentially increase your coagulability of your blood, and it's quite there have been people that have developed stroke secondary to COVID infection, so people need to understand that as well. When we're talking about stroke, you need to make sure that you're controlling your blood pressure. If your blood pressure is above 130/80, that is high blood pressure. It needs to be addressed. If it's not that severe, you might be able to address it effectively with diet and exercise. But once you start getting into 140s, 150s, 160s, you need to take some medication. I have a friend who is younger than me, in his 30s, who was diagnosed with high blood pressure and didn't take any treatment, didn't follow up with the doctor. And then a few years later has ended up with kidney failure. And this is a young man in his 30s on dialysis because of damage that has been done as a result of hypertension. And so it's really nothing to play with. Same thing with cholesterol. You know, we want to eat whatever we want to eat. You know, listen, you know, this food is delicious. I understand. Like we have these really amazing like culinary traditions, and that's wonderful. But all of that needs to be in moderation, because when your cholesterol is high, and you have diabetes and or hypertension, that is a recipe for disaster. And stroke ain't no joke, as Dougie says.
Well, we love it. HipHop Health. I love that initiative as well. So I didn't want to think that, oh, it's just COVID. No, they've dealt with COVID. They've dealt with stroke. They are educating our community through song and obviously entertainment, and giving people access. So it's inspiring to hear Dougie even talk about health and give, and he always has one more thing. Or even Chuck, you know, he's fighting the power through information and outreach on a regular basis. There's a place in our hearts for our community that we really are not certain that we can trust the medical system in. How do we become advocates, and why should we all at least go to the doctor twice a year?
You know, coming back to that conversation about what it's like to be a Black doctor and what motivates us as Black doctors, I will tell you that it's been really difficult for a lot of us because we have dedicated our lives to pursuing this career precisely so that we can improve health outcomes in the Black community. But then with this pandemic, we've had a lot of Black people who are not trusting us or trusting what we have to say about the importance of vaccination and other related information. What I will say is that we have to address where this distrust comes from. Frankly, just because we are Black doctors does not necessarily mean that we are entitled to the trust of our communities. Regardless of who we are, regardless of the fact that my skin is brown, your skin is brown, that trust still has to be earned. So I just want to say that. But at the end of the day, we have put in thousands of hours to get this information that's needed to protect our people. And we are armed with that information. And you have to check in with your doctor once a year is not enough, because a lot can change in a year. I've seen people's A1C go from 6 to 10 in a span of a year. You know, I've seen people's blood pressures jump up in a matter of months. And so it's important to check in, check your labs, check your vitals, Just see where you're at, regardless of how old you are. You could be in your 20s or 30s. And you still need to know where you're at, and just understand that we have the information, we have the data, we have your best interests at heart. We are not pawns in a greater conspiracy to, bring harm to the Black community. We are trying to save lives here. And so that's all I really have to say about that.
If you're there, and I appreciate it, because I believe and trust. I guess it's easy for me because we've spoken, and I believe, and I just need the help. And I know I can't help myself, and I need the insight from your study and dedication that doesn't come easy. Like, it's not easy to be a doctor, and then a Black doctor at that, in institutions that just aren't owned and ran by Black people. So, it's a double whammy just walking in there, where you're necessarily welcome. If Dr. Charles Drew is an example of how much the system loved him, he loved the system, he loved the community, he loved the system loved him back. Mm-hmm. But for being an advocate, walking in, knowing, writing down with your doctor the issues that you're having, not being ashamed to share with the doctor based on who they are, that you've got a rash that you don't understand and where that's coming from. Somehow you're coughing and you didn't used to cough. How can people learn to self-disclose to a doctor and get more comfortable advocating for the truth and being able to be honest, so you don't have to be ashamed of, I went out, I did something, I got a new burn, doc, versus keeping syphilis or keeping anything that, nobody wants to have, but you just might have made a mistake and you need treatment. How can we literally disclose and feel comfortable disclosing things with our doctors?
I think that's a great question. Going back to this idea of, previous egregious injustices that have been committed against Black people by members of the medical establishment, we have to understand, like, that's understandable and justifiable reason why people may not trust, someone in a white coat. And I think part of the problem with that is this idea that, like, there's a hierarchy, that somehow the doctor's here and you're here. We are a team. When we are in that clinic room, we have to work together, patient and provider, as a team. One thing that I see a lot of, even in some of my family members, is they will stick with the same doctor, even if that doctor is not serving them well or doing right by them. They will stay with the same doctor just because that doctor knows me. I don't feel like looking for another one. I would just say, if you need to find another doctor until you find one that you're comfortable enough with to work with as a team, like together as a team, to share what you're comfortable, someone that you feel comfortable enough sharing with, keep looking. There's no reason to accept subpar care. There's no reason to stay with a doctor that you don't feel comfortable with, who you feel might be, and some people feel like they may feel judgment or something like that. That is not our job. It is not our job to judge you. It is only our job to work with you to figure out how we can get you back to baseline and maintain your health. So that's what I'll say. I feel that, it's the onus is upon us as doctors and providers to make our patients feel comfortable and build that trust. But I will also ask people to advocate for themselves and their family members and do what they need to do to find a provider that they feel comfortable with. And that provider may be Black or may not be Black. What matters is that they care and that they get it and that they'll do right by you.
HipHop Public Health, which we both know, does a ton of outreach and a ton of, they're advocating for the community's health. What's it like for you to be a part of HipHop Public Health's public advocacy and outreach? I mean, what has it meant for you?
Again, like as a resident, a medical trainee, being a part of something like this has just been unbelievable, like just a dream come true. I never imagined that just me with a little pen and a pad in my little apartment here, I would be able to reach like so many people, even around the world with some of this content that we've put out, some of these animations and this music. It's been tremendous for me. I will say, that it hasn't always been, peaches and roses. We have had, we've been called everything but a child of God because of our advocacy for vaccination and other COVID protocols. But, we have to just act in faith, knowing that we are on the right side of history here. And that just using the sheer power of hip hop and music to communicate these very important messages this is what keeps us going. When we see that vaccination numbers are going up, when we see cases going down, we know that we're contributing to some of these positive trends. And I'm so blessed. I'm so grateful. And a little talent I have, I'm trying to use that talent to the best of my ability. And I hope to actually use hip hop not only to promote public health, but in the future, I hope to use hip hop to support medical education of Black people that want to become doctors and other health professionals. So that's coming down the pipeline as well.
I like that. We need to get Portia to find the video so everybody can at least see a video before we get off here. One of the more concerning things for me, the role of circulation, most people don't have an idea. Wound care, amputation. There are more Black people impacted by amputation based on diabetes. When we have family members that are diabetic, why should we walk them and get their circulation moving as often as we can? Because when they don't have that, that blood no longer circulates and it ends up with an amputation. Can you share with us why it's so important to move and keep this body moving every day around so that we can reduce the number of amputees in our community?
Absolutely. Diabetes is so common, but it's a devastating disease. I have seen it all, let me tell you. And, when we think about sugar levels, blood sugar is like poison to the nerves, to the organs. And anytime you have too much sugar circulating in your blood, it's going to damage everything. And exercise, movement is what allows our cells to pull sugar out of the blood and into the cells so that the cells themselves can function. Exercise is what does that, period. It is what allows our body to utilize the glucose that we consume. And so circulation, I've seen people that, because they aren't moving, and a lot of times people have diabetes, they may also can lead to heart failure, which prevents the heart from pumping blood effectively enough so that, and then also if you have high cholesterol, that clogs up your arteries and makes your veins and arteries less able to move blood to different parts of the body. Another thing about diabetes is that if the nerves are injured, you could hurt your foot and have no idea that you have like a cut on your foot. And then you could have bacteria get in there. Bacteria love to eat up sugar if you have tons of sugar in your blood. And before you know it, you have a raging infection on your foot and that can't be controlled and you have to have an amputation. All of these things, the tragedy of this is that they are completely preventable. All of these things are preventable. The minute you find out you got diabetes, you got to get on it. If you need to take insulin, if you need to change your diet, if you need to change your exercise regimen, you just got to do it. Because I've just seen it happen too often where everything goes. Your eyes, pins and needles, hands and feet. It's terrible, totally preventable. And that the whole family has to come in to support a patient with diabetes to prevent these terrible things from happening. The other thing I'll say about that is that I think I do feel that part of the reason why we may see higher rates of amputation in our community is in part due to medical racism and inadequate treatment of our people by providers. So that is, again, where diversifying the medical workforce comes in, to make sure that people are getting adequate enough care, where other options, if there are other options other than amputation, if there's other management options available, that your loved one will have a provider that will take the time to explore those options with you and provide effective diabetes control. We can fight it. We have to fight for ourselves in that respect, because no one's going to do it for us.
I love that. I just wanted to mention it because it's the first of the year. It's family and diabetes and families and talking about it. And I know Issa put quite a bit on the table. Let's take a look at some of those, at least one of the videos, because I love that. And I want to share with our audience the very commitment that you and Dr. Williams and the entire team at HipHop Public Health have continued to bring creativity to. If you would, Maestro Portia Monique. All righty.
Thinking about it.
It's thinking about it. It's thinking about it. It's a big thought. Maybe we'll have to do it another day, Portia.
We also did it in Spanish, in Unidad Comunidad. So
about community immunity. I got the vaccine, you got the vaccine, they got the vaccine, we got the vaccine. We can get back to normal, let me inform you, let's all get the vaccine. It's about community immunity. I'm talking unity for you and me. If Doc says it's good, then trust me, it's good. Now let's all get the vaccine.
Dr. Mo Flow.
It's the hip hop doc, ayy.
We gotta make this pandemic stop.
We on the clock, folks are not trying to get the shot. While we wary of these barriers, cause there's already a lot.
Alpha, beta, gamma, tricky variants like Delta. Others trying to break down our barriers.
They spread to different areas across all nations. We'll never see the end if we keep on waiting.
Let's get it straight. If people don't vaccinate, we know that COVID will continue to spread and mutate.
There's no debate when we gotta keep our loved ones safe.
From the school to the workplace, stay on the case.
And get the facts, ain't no time to relax, and that's fact. Help the body attack so our lives can bounce back.
To be free to move and do the things we do.
We gon' do what we gotta do to get through.
I wrote that one for Dr. Williams and I, and it's definitely one of my favorites of the anthology.
Well, I just wanted to let you know how proud I am of you, and that this was a phenomenal thing. So I'm glad. Thanks, Portia, and thanks, Helen, for sticking with us and making sure that we got to show this real MC who put down and was breaking bars and dropped the mic. So I love that. It's been a blast to see you again. I really appreciate you coming on Health IQ. We've got Women's History Month coming up, so I'd love to talk about women's health with you. Ladies and gentlemen, Dr. Mo, you dropping bars yet, or are you going to say goodbye? Which one are you doing today?
Oh, you want me to drop some bars?
I don't care. It's your turn. You just here on Rolling Out Health IQ.
Okay, I'll drop a couple bars before I go from the first video I did. Immunity instead of eulogy, duty for the community, getting it expeditiously, forget the conspiracy theories. Gotta get the blood ready to fight with some antibodies set to kill the virus on sight. It don't matter which type, we get them for free. You can bet they're set to protect us equally. Roll up your sleeve, cause the vaccine is key, cause it ain't about me, it's about we. Thank you.
Boom.
Shout out
Dr.
to
Mo.
Dr. Williams, Dr. Noble, everybody at HipHop Public Health. Thank you, Helen and Lori, for this opportunity. Thank you so much, Munson, for having me. And I'll be sure to look you up next time I'm in Atlanta. Please let me know. Drop me a line when you come to LA.
I'm gonna definitely do that. We love you here, rolling out. Everybody, this has been Dr. Mo. She truly is a change agent, HipHop Public Health. Thank you, and thank you, Dr. Williams, Chuck, everybody over there that's doing a big thing, doing big things for our community. But more than anything, everybody, just know that being a Black doctor, being a Black physician is not easy, but we have dedicated individuals who are committing their lives to helping preserve ours. So take care of your health. And if nothing else, get a checkup twice a year, just to kind of know your numbers, know where you are. And if you're nervous, find an accountability partner to make a difference and know your family's health history. You don't get anything out of this we've discussed. We talked about a ton of manageable disease. Know your family history. This is Munson Steed and Dr. Mo here on Rolling Out Health IQ. Thanks so much, Dr. Mo.
Thank you. Take care.